My name's Alan Higgins. I'm the Health Equity Network lead. And the webinar today is to launch the Making Manchester Fairer Inequalities Toolkit. And this has been eagerly awaited. 137 people on the webinar, which is one of our best turnouts for a Health Equity Network webinar. So good to see everybody here. The way these run, it's 12:30 to 1:30. In a moment, Cordell will introduce the work, and then Neil Bendel will talk through slides showing you just about what has been done in Manchester. And then we'll open it up for questions, comments and questions from everybody on here. And great that you've been able to put cameras on. If you could just observe the usual rules that when you're not speaking, just keep yourself on mute. And then we'll try and make sure we get everybody in. I will also say that the Manchester group on the Health Equity Network is the most active. That Beth, who's on the call somewhere, Beth Brady, has done a great job in getting people to join that group and being very active within the group as well, within the network. So that's something that hopefully will inspire others too. So Cordell, Dr. Cordell Afori, Director of Public Health in Manchester City Council. And would you like to introduce the work, Cordell, and then we'll go through to Neil.
Hi, good afternoon, everyone, and apologies for the delay. So yes, I'm Cordell, I'm Director of Public Health in Manchester and been leading the development of the Making Manchester Fairer programme in Manchester, which is linked to all of the Marmot City work, Manchester's 5-year plan to tackle health inequalities in our city, with a real focus on all of those social determinants of health. As everybody here knows, in order to address inequalities effectively, we need to make sure that we support people to measure and interpret data on health inequalities appropriately. So when we first started developing Making Manchester Fairer, one of the things that we included in our key principles was that we committed to measuring the gap in terms of health outcomes. So rather than doing what we usually do, which was comparing ourselves at a point in time to core cities or to Greater Manchester or to national averages, we wanted to continuously, for all of the indicators that we were monitoring, look at the gap between different communities and places within the city as well. So that as well as improving overall population health, we're making sure that we're monitoring our attempts to narrow the gap as well. The toolkit, which you're going to hear about today, builds on best practice, notably the work of the Scottish Public Health Observatory and also Public Health England previously. And the Manchester Measuring Inequalities Toolkit really embodies the partnerships approach that's at the heart of the Making Manchester Fairer programme. It's been produced by the University of Manchester in close collaboration with Manchester City Council's Department of Public Health. And I know Neil's done a brilliant job in leading all of that work. And I will hand over to him. Thank you.
Thank you, Cordell. Thank you for everybody on the call for taking a time out of your busy day to attend the webinar and the launch event for the new Manchester Measuring Inequalities Toolkit. Just looking at kind of who's on the call, I can see with people here from a range of local authorities, national organisations, neighbourhoods, and also from different parts of UK and Ireland, which is really good to kind of see the kind of range of reach of people which are kind of on the call. So in the webinar, I'm going to describe the rationale and purpose of a toolkit, so why we developed it, the content of the toolkit and the process we took to the actual development of it, what the current version of a toolkit looks like, and some reflections on the process and kind of lessons learned. And there will be an opportunity for questions and discussions following the presentation. I'm going to be leading the presentation, but because also on the call is my colleague Eliza Varga, who's a public health researcher at the University of Manchester, and Eliza has done most of the work on putting the content together and leading the kind of co-production of that. So a big shout out to kind of Eliza for all her hard work on this. So I will just share my screen. And put that on presentation mode. so that you can see that. So hopefully it will
That's
kind
good.
of move through. Okay, so Cordell's already kind of explained our Making Manchester Fair programme, which is our 5-year action plan to address health inequalities in the city. It's very much based on what Manchester residents and staff from a range of organisations and agencies have told us about the sorts of things which kind of influence their health, as well as the evidence from research and experts on health inequalities. The actual programme also includes the city's anti-poverty strategy, on the basis that we know that kind of poverty and the things that kind of link to it are one of the biggest kind of drivers of poor health and health inequalities. The Making Manchester Fair programme itself the action plan is based on a combination of 8 themes, which you can see on the slide there, and 4 areas of working that community groups and organisations have told us that we need to adopt in order to better involve them and the people they support and represent. The delivery of the action plan is based on a set of principles, which you can see there on the list on the right-hand side of the slide, at the heart of which is that commitment to monitor and evaluate everything we do to ensure that we are making Manchester fairer by narrowing the gaps within Manchester, as well as between regional and national averages. And our toolkit is part of our commitment to help and support people to do this in the most effective and statistically robust ways possible. So if we want people to measure inequalities in their area of work, it's important that we actually give them the skills and the toolkits to allow them to kind of do that. So why do we need the toolkit? Well, firstly, measures of socioeconomic inequalities are not just measures for health and care services. They're important markers for health and care policy and for society in general. A fairer society is, in generally speaking, a better society. It's important that whatever indicators and tools which we use to measure inequality are both accurate and presented in a way that minimises the chances of misinterpretation. And the more we can do that, and the more likely it is that will support better quality decision making by ensuring that health inequalities are considered in performance measurement and assurance, and in the range of decisions which are taken in order to respond to those performance and assurance processes. So Toolkit itself, it's a genuine partnership between the City Council, Department of Public Health, and the University of Manchester, and we're really grateful for the financial support we've received from Policy at Manchester as part of the UKRI Research England Policy Fund. As I've said, the Toolkit is primarily designed to equip analysts from across the health and care system with a comprehensive understanding of inequalities measurement, how they can be used. However, we very much want it to hope it will be valuable to anyone with an interest in health inequalities, including policymakers who also need to be able to interpret and act upon the data that they are presented with, so that they can kind of understand how that particular data feeds into the decisions which they're being asked to make. The toolkit is modular in design, as I'll explain. It doesn't need to be completed within a fixed time period. It's completely open access, and people don't need a learning account or a password to access it, which means that users can dip in and out of a toolkit and return to it at any point in the future to refresh their understanding of a concept or remind themselves of how to calculate or interpret a particular measure. There's no formal certification attached to it in terms of CPD points or anything like that, but all modules end with a self-test that can help participants to assess their learning on a particular module. So these are the 7 modules within the toolkit. Generally speaking, they go from a very kind of general introduction to epidemiology and inequality measures through simple measures of inequalities gap, and then getting into more advanced measures of inequality. As I said, they are modular. Anybody can use any one of those particular modules at any time, and they don't need to kind of have completed one module in order to move into the next one. So maximum kind of flexibility in terms of how the modules are used and how people interact with them. As I've said, the actual content generation kind of draws very heavily on previous work of Scottish Public Health Observatory and Public Health England, and these things often exist historically, but it's really, there's still really good evidence that's kind of there. Or we've utilised a lot of material. We've kind of made it more kind of Manchester centric, if you like, but also use kind of more interactive online methods for delivering that training. So these were often kind of fixed reports which were kind of available, or kind of simple spreadsheets, but we've kind of updated the method of delivery while drawing heavily on the actual content itself. Co-production is the heart of the work, as it is with the whole of the Making Manchester Fairer programme. So the initial content was produced by the University of Manchester, but it was subsequently refined by a co-production team. It's made up of people from partner organisations across Manchester and the Northwest region as a whole. So very much kind of co-produced by a range of people. Anybody kind of got a history in this area may remember some of these tools. The Scottish Public Health Observatory was produced way back in 2007, and Public Health England's Inequalities analysis tool kind of was produced kind of subsequently as well. So both of those things have proved very, very useful in helping to generate the content. In terms of the actual process, following the first phase of content generation, we did a structured review of the toolkit to understand people's opinions and thoughts on the content and format of a toolkit, and to identify any potential improvements that can be made. So this involved people from a range of different partner organisations and with varied skill sets, from analysts through to project managers, to represent the wide range of potential users. So we asked people were kind of allocated to complete kind of a randomly allocated module from a toolkit, and then we asked them to provide feedback via an online form. And this is some of the feedback that we had. So overall, the vast majority of people thought that the content was of high quality. It was well received and was found to be relevant. 7 out of 10 people, admittedly not a huge sample, but the majority of people who tested one of those modules reported that their level of knowledge was increased as a result of commenting on the modules, and the content and the material, and whether it met people's expectations, were mostly kind of very, very, very positive. We also asked people for their kind of suggested improvements, some of which we've kind of listed there, kind of a further reading section, more information on the mathematical calculations for those people who wanted to see it, some definitions, some kind of research evidence, so I suppose something about the kind of practical ways in which the methodology have been used, and the length of the modules was kind of questions in some cases. So those are all things that we've kind of taken into account after those feedback that we had. We did a further iteration of a toolkit, and it was also, if you like, stress tested by a range of kind of experts within the University of Manchester as well, to make sure that all the concepts and the way that they were described and the methodologies were all right and correct and appropriate. So after we've done all of that, this is kind of where we're ended up to. So this is the homepage of the toolkit. It's very much rooted in Manchester and its social history, kind of illustrated by the kind of picture that you can see there of the kind of modern and the kind of older, kind of juxtaposed within Manchester. But even though it's, as I say, a lot of the examples of Manchester, all the methods in the toolkit can be used to investigate inequalities in any area or setting. So the content itself is independent of an area or of a particular theme, and can be applied to any kind of aspect of inequalities, whether that's inequalities in income or education or housing, as much as it can be to kind of health. So it's very much a measuring inequalities toolkit as opposed to a measuring health inequalities toolkit. And again, that's all about making sure that the content is as flexible and as open to as many people as possible. This is just a kind of example of kind of how we've tried to, I suppose, explain inequalities in a kind of more kind of user-friendly, less academic in the kind of manner. So the kind of concept of a Manchester kind of garden ecosystem. So in the same way that within a garden, every plant has an inherent value and right to thrive, in the same way that, you know, neglecting any part of our community is detrimental to our collective well-being and is a grave injustice. So again, trying to use kind of analogies and kind of simple ways of explaining the concept within the toolkit itself. So our next steps, obviously, it's been formally launched today as part of this webinar. Our next stages are very much to kind of, you know, disseminate the toolkit, but also kind of try to build it into professional development and training programs for analysts and other groups, so that measurement of inequality forms part of their, could be their induction package as an analyst or other routine CPD, to really embed it in existing professional development and training, rather than it being a kind of external separate thing. We're very keen that the toolkit's a living resource, and that, you know, we continue to adapt it in response to user needs and opinions. In this spirit, all users are directed to an online feedback survey on completion of the toolkit, and as part of that survey, users have the option to provide us with their email addresses if they're interested in participating in a follow-up survey 6 month period, to help us gauge the long-term benefits of the training. So just to kind of end up with some kind of lessons that we've kind of learned from the work that we've been doing, there's clearly support and interest in the toolkit, the nature, both from the people that have actually tested it so far, but also I think the number and range of people in this webinar today. Co-production in the material is really important, but as with any co-production of policy, strategy, service models, this takes time, and it's really important to kind of build that into the time scale when producing those new tools and products. And that was probably the kind of aspect of the toolkit which took the longest, and led to us putting back the kind of endpoint, the release date a number of times, but we've got there now. And finally, as I've said, we don't want this to be a standalone resource that sits outside of existing training and professional development activities, not just for healthcare analysts, but for other professionals, public health specialists, practitioners, but a range of other people as well, who might be interested in inequalities generally and how we measure that. So it forms an integral part of people's training, and you know, that's going to be one of our key measures to say that we've been able to do that. And finally, just to kind of acknowledge formally the financial support we've had from Policy at Manchester, which is University of Manchester's kind of academic, commercial, you know, kind of partners interface within the University of Manchester as part of the UK Research, UKRI Research England Policy Fund, and we're very grateful for their ongoing support with this piece of work. So that's all I wanted to say by way of background to the toolkit and how we've created it. Very happy to take questions or thoughts afterwards, which I think Alan's going to lead the next steps of the webinar.
Excellent. Thank you so much, Neil. I will pick up a couple of questions that were in the chat. I've got one to begin with, so everybody else, please do get your questions lined up and use the hand facility, and then I'll come to you. I think what I picked up, Neil, is that you said the toolkit is applicable to any geography in the country. Is that right? Is that what can I just check that with you again? Yeah,
I mean, as I say, the methods are very much designed to be, I suppose, linked to the data that an individual has. So it's a case of, given a particular data set that people have, that data set may be information which has small units of geography in it. It may be a data set that contains information about users of a particular service. So it's very much about fitting the method to a data set that's kind of available, rather than thinking about a particular method and then what data set you would use to kind of available. So if there is information which is about smaller geographies, and there are particular methodologies which are particularly suitable for analysis of data at small geographical levels, then certainly it can be applied to that. It's very much methods applied to the data that an individual's had, rather than the other way around, I guess. Excellent. That was really good news. And Damien also asked in the chat, is it online and available now, or is that coming up shortly? No, it's available now, and as I've said, it's on the university's open online learning platform. You don't need to register with that. You don't need a user account. or anything like that. So as long as someone's got access to the internet, they can access the toolkit.
Okay. It might be good if we can post a link to that.
Absolutely.
At some point after the webinar. Excellent. Sandra, you asked a question in the chat. Sandra on Koroku. Would you like to come on and just ask that question of me?
Thank you very much. Thanks for trying to pronounce my last name. It's Mukoroku. Yeah, my question is on the development of your toolkit. First and foremost, you're doing an important job. Good job to you and your team. I'm looking at the theoretical framework that was used in the development of your toolkit. Did you use any model or theory in developing your toolkit? That's my first question, but I'll wait for you to take that.
No, not really. I mean, I'd say it's very much designed to be a kind of neutral framework, I suppose, in terms of a set of methodologies that can be used to look at inequalities through whichever lens that an individual kind of wants to do so. So it's very much independent of any particular framework or any particular kind of model of inequalities.
Thank you very much. That feeds into my second and last one, because we presently, my team and I are working on developing a toolkit, and we reviewed the existing toolkit, and one of the findings was that there's no feedback system or evaluation to check is what this toolkit actually working, what can we do better in it, because it should be a live document that we could always amend and keep working on it. So using a theoretical framework would help you to maybe identify specific outcomes you're looking at in your toolkit, and then know how to inform the feedback service or the evaluation service again. But you've done a very important one, and it's a live document. We can keep beating it into shape as time goes on. Thank you so much.
Yeah, thank you. More than happy to. I think that's very helpful. As I said, and we're certainly anybody that on this call who does kind of use the toolkit and will be interested in kind of leaving their email addresses kind of with us, such that we can then come back to you in 6 months and do some kind of proper evaluation, not just of the toolkit itself, but in terms of whether the additional skills and kind of knowledge developed through the toolkit have kind of helped to kind of locally to kind of inform the way that you're looking at inequalities locally. So very key to kind of pick up that kind of feedback, as well as the technical feedback on the actual content of the toolkit, how it's actually working. Excellent.
Marie has asked a question in the chat, and she's explained that she can't come off a mute because she's in a public space. She's asking, is the work linked in any way to donut economics?
The toolkit, as I've said, is largely a kind of methodological kind of construct, but if people that are kind of using it kind of want to kind of link it into whatever kind of application they want to kind of use it, then I suppose kind of donut economics might be a kind of way of doing that. But again, happy to kind of pick that up outside of the call if it's kind of more specific technical kind of question that you kind of may have. Really.
Okay. One more call from the chat, and then I'll go to the hands up. Janine, would you like to come on and ask this question, Janine?
Sorry, just trying to get off mute and off camera. Yeah, just to say, is this open source and accessible to people in other systems? Because it looks really, really helpful and useful.
Yeah, as I say, absolutely. Once you've shared the link, you can then just use that link with that. And yes, you don't need to register. You don't need to have a learning account or anything of that nature. So you just go ahead and use it. And in fact, that's part of the university's commitment to kind of doing that. And part of the reason we're able to get the funds that we got to help us develop this was on the basis that it does sit on the university's open access learning portal. So yes, it is accessible to anybody.
Brilliant, thank you.
Before I go to the next question from Rachel, there's a lot of people have given a thumbs up to getting the link posted. I wonder whether Beth or anyone could post in the chat what the link is. I'll leave that with you. And then Rachel Christie. Oh, you're on mute, Rachel, I think. Oh, doesn't seem to be working. Try again. Tell you what, Rachel, you might need to log out and in again. That's the only solution I've got, and then we'll come back to you. Sorry, still not hearing you. Come back to you in a minute, Rachel. Rosalie.
Can you hear me?
Yes.
Okay, great. Thank you so much. This looks so useful, both for me and for a lot of the people that I work with. My question is, it sounds like you're sort of starting from the point that people have a data set. And one of the things I've really picked up on, I'm a social anthropologist working on data equity and health equity, is the challenges of getting a complete enough data set for some populations with health equity challenges. And I just wondered if this is something that you either deal with within the tool or something you're looking at in your group kind of alongside, because I'd just be really interested to hear how other people are grappling with the problem of getting enough of the right type of data in a way that doesn't do kind of other subsequent harms to the service and staff and so on. Thanks.
Yeah, I mean, I think obviously that's a key question. Obviously, this is a set of methodologies that you can apply to a data set. So that assumes that you've kind of got that data set in the first place. I think obviously kind of the various modules go through what sorts of data that you need in order to be able to complete a particular kind of metric. So the sorts of data that you need for kind of simpler methods will be kind of less than some of the data that you need for more complex methods. So it certainly goes through that. It certainly talks about kind of measures of I suppose kind of variation around stuff. So the extent to which you kind of know the kind of range of around various measures. So it certainly goes into some of those things in terms of kind of kind of getting a data set. One of the things that we've established in Manchester is a health inequality is an inequalities data development group, where we're kind of bringing people together from a range of different organisations to just kind of discuss kind of issues around health inequalities data. And we've got people on that from from in different parts of the council, from the local care organisation, from the hospital trust, and others, to try and do that. So again, maybe one of the things we can do in spirit of collaboration is have to share the terms of reference and other kind of things relating to that group, if that's something that individuals are interested in, establishing something similar kind of within their own area.
Excellent. Thanks very much. Helen, then we'll try Rachel again. Helen first.
Can you hear me okay?
Yep.
Yeah. So some information that was just discussed answered part of my question about, we don't, as a VCSE, we don't have large data sets. But I think there's a question that I still would like to ask. So our work is all about demonstrating the impact of uninvited weight talk or weight stigma and what the impact of that is. There's lots of evidence out there around how it leads to less cancer screenings and everything, but on a more sort of local level, I want to be able to demonstrate that for when we speak to PCNs or ICSs, to say, look, these are all the people that you spoke to about weight, because we know this through your coding system, and this was the impact in your particular population. So I wonder, what pieces of information, and who do I go to ask for that information? How do I get hold of a data set that has, it might be two different data sets that we'll have to put together and use information from, but just some pointers really to sort of like poke me in the right direction.
Yeah, I mean, maybe that's something that there is a kind of separate kind of discussion forum within the Health Equity Network web kind of system, isn't there? I think that you can maybe post that, so you get that kind of feedback, not from people on this call, but from the people who may not work in that area but not be on this call. So I definitely think it's something that the Health Equity Network, as a kind of community of practice can potentially help you with, but I think just a couple of minutes on this call probably wouldn't do justice to that question, I think. So I probably encourage you to kind of post something on the Health Equity Network and encourage colleagues to respond to you that way.
Great. Thanks very much, Helen and Neil. Rachel, have one more go, and if not, then I'll go through your. Yeah.
Can you hear me now? Great. Thank you. So firstly, just to say, this looks really great. I'm a population health analyst, and I work for North West London ICB. So I definitely want to get other analysts looking at this toolkit. But my question is, what module, or is there a sort of summary that you think is most applicable to non-analysts? So people who are going to be interpreting and just need to understand the measures, but don't need to understand the more technical side of things.
Yeah, so the very first module is a kind of very simple introduction to epidemiology, inequalities, gaps, inequalities, general. And some of the feedback that we've had from people who've kind of done that is actually that first module is a very much a kind of standalone module about inequalities, why they're important, and the sorts of factors that kind of go into that. So I think, as I say, certainly from what people have told us, is that very first module is probably the most general in terms of interest. As I say, as you get further through the module, obviously they do become more statistical and more kind of technical. I think one of the things that we need to do is think about that kind of layer, if you like, of users which are non-analysts, but necessarily people who might get a report, for example, which has the results of that analysis in it, and it might refer to a particular measure, and they need to kind of know how to kind of what that means in very simple terms. So I think there's probably a kind of part of our development of this will be kind of testing it with some more kind of policy, type people to kind of test out that aspect of it. I think at the moment it is admittedly quite analytically orientated, but it's certainly not something that we want it to be just for analysts by any means. But certainly the first module is, as I've said, probably the most general one for you to have a look at first.
Thank you.
Thanks very much, Rachel and Neil. I'll read one question out just to help manage time. Neil, have you involved those working on rural inequalities given their distinct nature and small numbers?
In terms of the rural, obviously, we mainly tested it within Manchester, so Manchester isn't really what we call a rural area by any means. But in terms of small numbers issues, obviously that's certainly addressed, throughout the toolkit, the issues of, I suppose the reliability of doing this with small numbers. So that's a key statistical concept, which is there throughout really. So yeah, I think that aspect of it. But if there's any colleagues here from rural areas that want to have a look at it and say, does it say enough about rurality, I suppose, and the kind of urban-rural split, then again, more interested in hearing their kind of thoughts on that particular issue, whether we sufficiently build it into the toolkit, even if, let's say, admittedly, it's not necessarily a very Manchester issue for us.
Thanks very much, Neil. Thanks, Sue, for that question as well. Christine Camacho.
Hear me?
Yes.
Yeah. Okay. So it looks really good. I was just having a quick look online. Just some of my thoughts around this. I think this would be really ideal to test out in an NHS setting. We are data rich, but often our analysts don't have that public health background. So I think it would be really helpful to do some work around it and kind of see how trust analysts would get on with something like this. One of the thoughts that came to me is whether there's any scope to kind of develop a program to support the rollout of this toolkit, because I think there's some groups of people who may need a bit of support, like you mentioned earlier, a community of practice to kind of, I'm thinking almost like, can you give someone a data set and have some worked examples of how they could go through some of this, perhaps with support from the university or some really experienced analysts like yourself to help those people to develop some of those skills. And really, I know we've not got a lot of time today, but really happy to pick up a conversation at another time.
Yeah, that'd be great to pick up that conversation. I say we did have, amongst the people who kind of tested it for us were colleagues from, what was the CCG business intelligence team, now the kind of ICB intelligence team, and we certainly got people, from the trust MFT who've kind of involved with this work in terms of the development of it. But yes, I think in terms of that, pushing it out and making it part of everybody's business, if you like, that's something we're definitely really keen to think about how we can do that. But I think you're right, there's the kind of people have to think inequalities is a sufficiently important issue in the first place before we kind of start getting into the kind of how you measure it. So there's certainly something to kind of pick up through that. So yeah, happy to have a conversation with you outside of the meeting.
Thanks, Neil.
Thanks a lot, Neil. Thanks, Christine, as well. Jordan Moore.
Hi, sorry about that. I was just frantically finding my unmute button. It was basically looking at data tells us what we know and what we're aware of. It helps capture that, but it doesn't necessarily tell us what we don't know. And my thoughts were: are we capturing insights and lived experience of residents and matching them up with this data sets to ensure that we understand the picture better?
Yes, I think there's a couple of responses that I think often, kind of link back to what Cordell was saying. Part of what it is that we don't know is the scale and trends in inequalities, because traditionally we don't measure them very much. So I think, understanding particularly trends in inequalities, and whether actually when we look at some of our key performance metrics, whether we are maybe slightly guilty of kind of patting ourselves on our back for our overall improvement, but not necessarily seeing the full pattern in terms of how we improved, but not necessarily reduced inequalities at the same time that we've kind of done it. So I think shining a light on the inequalities is actually part of that, what we don't know. In terms of your second point, absolutely. I mean, this isn't this is a toolkit to kind of support a particular one element of that, looking at inequalities. It's certainly not kind of all of it, and absolutely understanding those kind of lived experiences and the kind of what people are telling us is absolutely part of what systems need to do to understand people's actual how inequalities actually applies to them and has affected them on the ground. So absolutely something that we need to be considering. But I mean, as I say, this is the toolkit is kind of part of that, but it doesn't by any means exclude other in many ways more valuable kind of lenses on the issue. So absolutely, I totally agree with you on that point.
Yeah, perfect. And just whilst I've got the limelight, I am looking at capturing insights from Salford residents and Salford community champions, but I don't have a resource or a software to do so. So if anybody knows of a good way to capture insights from communities so we're not losing them constantly, that would be really useful.
Thanks very much, Jordan. If anyone wants to pick up that point, please do post on it. And it's in a similar vein, Neil. Fiona, would you like to come on and ask a question?
I hope you can hear me okay.
Yeah, go ahead.
I just wondered, I work within MFT, and I just wondered, is there questions around subjective well-being within the toolkit, because we know that it's an important indicator of inequalities. So I was just wondering, does it look at it through the lens of subjective well-being?
I mean, I think obviously if what the toolkit would do is, if you have the collected data on well-being, based on the nature of the data that you've collected, the toolkit would allow you to kind of identify the best method of you kind of summarizing inequalities in that kind of well-being. So as I say, it isn't a kind of topic by topic information.
This time has been rolled out. Oh, sorry.
So I think we're overlapping slightly in terms of our thing. Could you repeat that second?
Sorry about that. I was just wondering, am I right in thinking that there's not yet a commitment from trusts and local organisations and primary care to roll this out as yet? It's in the early stages.
I mean, this isn't linked to any national, or as far as I'm aware, Greater Manchester or any other ICB commitment. But obviously, this is there are increasingly kind of skills and careers frameworks and for analysts, which maybe weren't there 10 years ago or kind of more. So the idea of analysts having a professional set of skills that they kind of need to kind of demonstrate is increasingly prominent, as is professional registration of analysts. So this was very much kind of we're very much looking to kind of see how this is kind of built into that that kind of area of stuff. So there is no commitment in terms of a kind of policy imperative to this, but as I say, it does fit very much with the kind of idea of professionalization of analysts and skills and careers skills frameworks for analysts, that in terms of the sorts of things that they need to know in order to do their job as an analyst. So I think there's very much a kind of connection with that aspect of what's happening in the analytical system, I suppose.
Okay, thanks.
Thanks very much, Fiona, and Neil as well. Great to see the responses to Jordan's question in the chat. Alison, I wonder whether you could pick up Sandra's point in the chat about the question on capturing the community, if you could find that and reprint it. There aren't any more questions at the minute, which means I get to jump in with a question. I've just reflected on that last one. Healthy life expectancy as an indicator is an element of subjective well-being within its measure, which might be helpful. Neil, I haven't looked at the link yet. One of the issues for us when I'm working in Cheshire Mersey is about monitoring inequalities in health and finding that the measures that we have are not greatly or quickly responsive to the activity that we undertake. You know, they change every 5 years or something, 3 to 5 years. How are you dealing with that issue about whether you've got something that gives you more immediate feedback?
I mean, obviously, kind of separate to the toolkit per se, but one of the things which we're very much kind of trying to do in Manchester is to kind of embed kind of some concepts of gap metrics, as we're calling them, into kind of routine performance management. And often, you know, if you take a kind of, you know, logic chain, theory of change kind of approach, it's those kind of things which people are doing that kind of then connect into the bigger outcomes that we're trying to do. So by embedding it into, you know, if we've got a sense of the fact that, you know, inequalities in particular, in the delivery of particular services, for example, are widening or narrowing over time, then that will then give us an idea, you know, through a kind of theory of change approach, whether those kind of in the longer term, those kind of bigger outcome measures are likely to be, you know, heading in the direction that we kind of want them to be. So yes, I think obviously where there is a, you know, we can still apply those to those kind of big high level stuff to get an idea of whether you know, changes in you know, not just health measures, but things like school readiness, for example, is a key one for us. Are kind of gaps in those are kind of narrowing. But in terms of that kind of long versus short term, again, it's, you know, trying to apply this not just to kind of outcome measures, but to kind of output type measures as well, and equally input type measures, to see how we can think about these inequalities, you know, at different stages of that kind of theory of change.
Sorry, I was nodding away and making affirmative noises there, but you couldn't hear any of it. So thank you very much, Neil. That's really interesting, and some of the way we are thinking Cheshire Mersey. Sharon has put a post in the chat. I can't quite tell, Sharon, whether I can only see that or whether everybody can see that or not. But it was just making a link to some work in a population health academy, which is happening in Cheshire Mersey, and may well be happening in other boroughs as well. And yes, Sharon, I was thinking about that link too. Okay. Any further questions? And you probably haven't been able to follow the chat, Neil, but it's been really positive. You've got lots of thanks for sharing the work and people finding the toolkit very useful, even at, you know, just first look. So allow another minute or so to see if anyone else wants to come in with a question. And if not, then that's fine as well. The good weather up here in Manchester in the northwest, we need to get out there and in it. Thank you so much, Neil. You worked very hard there, taking all those questions and responding to them. So that has been excellent. Thanks to everyone, one for doing this work, but also for attending the webinar today. If it's your first time on a Health Equity Network webinar, then you get another chance on Thursday of this week. When we have another webinar, it's another toolkit, this time looking at local climate change adaptation. From Jess, who's working in University of Exeter, I think. So please do join us for that. Otherwise, we will be putting an edited recording of this webinar up on the Health Equity Network website. I didn't check with you, Neil, but people were asking if we could share the slides, and if we can do that, then we can put it on the network. That's
yeah, absolutely, no problem at all. And again, if anybody's interested in doing it, you know, feel free. One of the things we need to test, I suppose, is whether it falls over if lots of people access it at once. So, you know, do feel free to kind of access it, have a look at what's in there, and also if anyone that's kind of completed it, please fill in the survey at the end. It'll give us some really good feedback, and also anyone interested in helping us to kind of review it in 6 months or so, that'd be really helpful as well.
Excellent. Great. Really good affirmation in the chat there. Thanks very much, Neil. Thanks very much, everyone. See you all again, I hope. Bye.